birth control methods. So students, as the name is suggesting, in this particular topic we are going to be studying about contraceptives and the different types of contraceptives. So students, let us begin. Now let us answer the most common question. What is a contraceptive? To put it very simply students, birth control measures or contraceptives are methods which deliberately, that is, which deliberately prevent fertilization. Students, I can also say that these methods help to prevent unwanted pregnancies. And students, this is the need of especially our country where the population is increasing at an alarming rate. Now students, moving on, an ideal contraceptive should be one which is very easily available. It is user friendly, meaning it should be very easy for it to be used by the user. Then obviously it has to be effective and there should be no or very few side effects. Now students, I repeat again, an ideal contraceptive or an ideal method of birth control should have the following characteristics. It should be easily available, it should be very easy to use, that is user friendly, it should work, that is it should be effective, and it should not have any side effects or it should have very few side effects. Now students, type of contraceptive methods are mainly divided into two types or two parts. We have the temporary methods and the permanent methods. As the name is suggesting students, the temporary methods are for temporary use and the effect of these contraceptives is not forever, it is not lifelong and it can be reversed. Students, under temporary contraceptives, we will be studying various methods like the natural method, also called as the safe period or the rhythm method, followed by coitus interruptus. Then we will be studying about lactational amenorrhea, followed by chemical methods. Then students, then we talk about the barrier methods, and finally under temporary methods we talk about the physiological, meaning the oral devices. Now students, in case of the permanent methods there are two major surgeries. One is vasectomy and the other is tubectomy. Now students, let us talk about these different methods of contraception one by one. At first we'll be focusing on the temporary methods and we begin that by learning about the natural method, also called as the safe period or the rhythm method. Students, this particular method works on the principle of avoiding the chances of fertilization. That is, we are going to avoid the chances of the fusion of the sperm and the ovum. Students, it is generally known that a week before and a week after menstrual bleeding starts is considered to be the safe period for sexual intercourse without the use of any kind of contraceptive device. Students, basically just after the female gets her period, it is generally safe to have unprotected intercourse because the chances of ovulation will be very less. Students, in this method, it is based on the fact that ovulation generally occurs on the 14th day of the menstrual cycle, and therefore 1 week before and 1 week after the menstrual cycle begins should be safe. Students, its drawback lies in having a high rate of failure. Basically students, generally ovulation will occur on the 14th day, but this is not a foolproof method. Sometimes ovulation can occur much earlier. So in such cases, this method may fail. But one very good plus point of this method is that it does not have a single side effect. Moving on, students. Now in periodic abstinence, students, this is another word for the rhythm method, that is periodic abstinence. In this method, couples avoid or they abstain from coitus from day 10 to 17 of the menstrual cycle when ovulation is most expected. Students, these days, that is day 10 to 17 in the female menstrual cycle, are considered to be the most fertile. Basically, these are the days where ovulation is very probable to occur. Students, coitus is the scientific term or the biological term for sexual intercourse. Moving on, students, as chances of fertilization are very high during this period, it is called as the fertile period. Moving on, students, conception in this case could be prevented by abstaining from coitus during this fertile period. Next, let us talk about coitus interruptus or withdrawal method. Now students, if you remember, just a few moments back I told you the meaning of the word coitus. It means sexual intercourse. Now we are adding another word after coitus, that is interruptus, meaning sexual intercourse is going to be interrupted. So let us see what this method is about. Basically, students, in this method, the male partner withdraws his penis from the vagina of the female just before ejaculation to avoid the deposition of the semen in the female reproductive tract. Basically, students, this deposition of semen in the female reproductive tract is called as insemination. So, if the penis is withdrawn just before ejaculation, then insemination will obviously not occur. Now students, this is the most oldest type of natural method of contraception. This method has been also mentioned in one of our Vedas. Students, in this method there is a drawback. Let us take a look. Students, before the actual ejaculation, pre-ejaculation fluid is secreted, and this pre-ejaculatory fluid may contain some sperms sometimes. Now, these sperms can fuse with the ovum and lead to fertilization. But students, again, one of the best plus points of this method is that it is completely natural and therefore it does not have a single side effect. Next students, let us talk about lactational amenorrhea, that is the absence of menstruation, during the period of intense lactation. Students, this particular method is based on the fact that ovulation does not occur during the period of intense lactation following parturition, that is following the delivery. Students, basically not just ovulation but the entire menstrual cycle comes to a stop during this particular period of intense lactation. Basically students, it is seen that as long as the mother is breastfeeding the child fully and regularly, the chances of conception are almost negligible. This has some hormonal reasons behind. Students, during intense lactation, the levels of progesterone are quite high in the female's body. And if the progesterone levels do not drop, then the menstrual cycle will not keep on occurring. Basically, for the pituitary gland to secrete FSH, that is follicle stimulating hormone, the progesterone levels need to drop. Moving on students, now this particular method is effective only up to a maximum period of 6 months after delivery. But students, again, there are some chances of failure in this method. But again, the plus point is that there are no side effects. Moving on, students, as no medicines or devices are used in these three methods which we just saw, the side effects are almost nil. And students, we don't even need to say almost. The side effects are completely non-existent. Now students, these were the natural methods of contraception. Let us now move on to certain artificial methods, and in that firstly we'll be discussing about the chemical means. Students, chemical methods or chemical means are the use of chemicals like foam, tablets, jellies and creams which are used by the female. Students, in case of chemical methods, there are various chemicals known as the foam tablets, jellies, creams which are used by the female partner. Basically, students, before sexual intercourse, if these chemicals are introduced into the vagina, they adhere or they get stuck to the mucous membrane which is lining the vagina and immobilize and kill any sperm which enter the female reproductive tract. Students, a foam tablet is a tablet which once inserted inside the vagina creates foam which spreads all over the inner lining of the vagina. Students, basically these particular tablets or jellies or creams contain spermicide. One of the most common spermicides which are used is nonoxynol 9, and the name itself is telling you that a spermicide will be a chemical which will kill sperms. Moving on, students, basically there are some side effects. Sometimes allergic reactions can be caused due to these creams or chemicals, and they may lead to the failure of. Students, sometimes allergic reactions may be caused due to the use of these chemicals, and also there are some chances of failure. Next, students, let us talk about the mechanical methods or the barrier methods. As the name is suggesting, in these methods, a barrier is used to separate or to prevent the meeting or the fusion of the male and female gamete. Students, the ovum and sperm are prevented from physically meeting with the help of certain barriers. I am talking about the use of certain devices known as cervical caps, condoms, diaphragms, etc. These barrier devices are available for the use of both males and females. Students, one such barrier is the condom. Then we have diaphragm, cervical caps as well as cervical vaults. Now students, we also have certain other methods known as the. Now students, other than the barrier methods, there is another method called as the intrauterine devices. We'll be talking about that a bit later. Now students, let us first discuss one of the most effective methods of contraception which is most widely used throughout the world, that is the condom. Students, these barriers are made up of thin rubber or latex sheath. Students, these are used to cover the penis in male or the vagina and the cervix in female just before sexual intercourse. Basically, students, these barriers, even though they are very thin, they are very powerful and they do not tear easily. Students, Basically, condoms prevent the entry of the ejaculated semen into the female reproductive tract. And not just this, students, they not do, they not only prevent fertilization and therefore pregnancy, they also prevent the transmission of STDs from one partner to the other. Students, condoms are 97% effective, and the 3% of the times when condoms fail is because of some manufacturing problem. Now students, condoms, as I just mentioned, prevent conception, and they also prevent sexually transmitted diseases. Students, condoms are very simple and very effective method, and they do not have any kind of side effects. Also, it protects the user, as I just mentioned, from sexually transmitted infections like AIDS. Moving on, students, condoms should be properly discarded after every use. Students, they cannot be used multiple times. Next, Nirod, students, is the most widely used condom in India. Moving on, students, and students, this particular condom is very easily available, and it is in fact given for free by the Indian government. Next, students, let us talk about diaphragm, cervical caps and vaults. Now students, condoms are generally used by females. Now students, condoms are generally used by males, whereas what you see here, that is the cervical caps, are generally used by females. Students, these are also made up of rubber, and they are inserted into the female reproductive tract to cover the cervix before coitus. Students, these particular devices prevent conception by blocking the entry of sperm through the cervix. But as you must have guessed, the penis is going to come in contact with the vagina, and therefore these particular devices will not be helpful in preventing sexually transmitted diseases. Next, students, these particular diaphragms are reusable. Many of these diaphragms are actually made from plastic as well, and they have to be washed before they are reused. Generally, students, it is advised that diaphragms or cervical caps need to be kept blocking the cervix even after 6 hours of intercourse, to be sure that no sperms are present in the vagina. Now students, after these methods, let us talk about them in. Now students, other than this, sometimes spermicidal creams, jellies and foams are used along with these barrier methods to increase their contraceptive efficiency. Students, basically we are combining the two methods so that the chances of pregnancy will be very less. Moving on, students, now let us talk about another method to prevent pregnancies, that is the intrauterine devices, which is abbreviated as IUDs. Now students, these are clinical devices made up of plastic, or sometimes they are made up of metals. Now what you see here is a IUD made up of plastic, but it has a covering of copper metal over it. Students, generally IUDs are inserted into the female uterus only and only by a doctor or a trained nurse. Now students, this is not a surgical procedure, and the IUDs are inserted into the uterus through the vagina. Students, these now students, IUDs are of different types. We have non-medicated IUDs like the Lippes loop. Then we have copper releasing or copper secreting IUDs like CUT CU7 multilode 375. Other than this, there are also hormone releasing IUDs like Progestasert and LNG20. Students, let us talk about the most common of these IUDs, that is the Lippes loop. Let me tell you students that this was one of the first intrauterine devices which were brought to the market. Students, these particular IUDs were made completely of plastic, and students, basically as you can see, they contained a double S loop. Students, this is basically, can I say, a foreign object inside the uterus. So if there is a foreign object inside the body, obviously the body is going to react by producing more amount of white blood cells. So students, the presence of the Lippes loop inside the uterus attracts macrophages, and these macrophages phagocytose whatever sperms which enter the vagina. Now student, now students, just imagine that the number of macrophages in the uterus is very high. So now whenever any sperm who enter the uterus will be killed, that is, they will be engulfed by these increased number of macrophages. This is the way these loops used to act as a contraceptive method. But students, these loops also have a high rate of failure, and therefore they are no longer used. Next students, let us talk about the copper releasing IUDs. As the name is suggesting, these are IUDs which contain copper and constantly keep on secreting or releasing copper ions in the uterus. Now students, the presence of copper ions in the uterine fluid decreases or suppresses the motility of the sperm, thereby making it easier for the macrophages to engulf them, and also students, copper ions reduce the fertilizing capacity of the sperms. Students, next we have the hormone releasing IUDs. As the name is suggesting, these are IUDs which keep on releasing small amounts of certain hormones. Now students, these IUDs make the uterus unsuitable for implantation, and they also make the cervix very hostile to sperms. Students, these delay pregnancy for a very long period. Now just imagine if there is a particular IUD which is constantly secreting progesterone. Due to this students, the level of progesterone in the female system will never become very low, and therefore this can actually even prevent ovulation. Now students, so it is very obvious that hormone releasing IUDs will be the most effective, because just like any other IUD, they are foreign substances inside the body. So therefore they will also attract macrophages, and other than that, by the hormones which are secreted by them, they will make the uterus unsuitable for implantation and also make the cervix hostile to sperms. Now students, moving on, IUDs are very ideal contraceptive methods for females who want to either delay pregnancy and to space the children. Students, it is surprising that these IUDs is one of the most common form of contraceptive method which is seen in rural India. Moving on students, there are some drawbacks of IUDs. For example, IUDs may be spontaneously expelled from the uterus without the. Now students, sometimes IUDs may be spontaneously expelled from the uterus without the female even knowing about it. Other than that, IUDs may lead sometimes to occasional hemorrhage, that is internal bleeding, and also chances of infection in such cases is very high. Moving on students, now let us talk about the physiological devices of contraception. I am basically talking about the oral pills. Students, these are used in the form of tablets or pills and students, these are used in the form of tablets or capsules and hence are popularly known as pills. Now students, oral administration of small doses of either progestogens of progestogen-estrogen combination which can be used by females. Also, pills have to be taken daily for a period of 21 days, starting preferably with the first 5 days, preferably within the first 5 days of menstrual cycle. Now students, this is actually one type of pill known as the daily pill. There are many other types. We also have once a week pill and there is also emergency contraceptive pills. Let us talk about these pills one by one. Now students, these pills generally work in the same way. The only difference being is that they have different concentrations of the hormones. The only difference being that these pills have different concentrations of the hormone. Generally, these pills inhibit ovulation as well as implantation, and they also alter the quality of the cervical mucus to either prevent or to slow down, that is retard the entry of sperms. Students, other than this, there are some side effects which are connected to the use of these oral pills. These include nausea, weight gain, tenderness of breast, slight blood loss which may occur between the menstrual periods. Also students, recent studies have shown that prolonged use of these oral pills has been connected to different types of cancer like breast cancer and cervical cancer. So students, before taking these oral pills, we always have to consult with a doctor. Moving on students, one of the once a week pill which is very commonly used in our country is Saheli. It is a oral contraceptive for females which contains a non-steroidal preparation, and as mentioned, it is a once a week pill which has to be taken only once a week, and it has very few side effects and very high contraceptive value. Now students, there are also emergency contraceptive pills which are also known as the day after pill or the morning after pill. These are generally taken after sexual intercourse, and for them to be effective, they have to be taken within 72 hours of coitus. Students, these pills should be taken very rarely and only in case of an emergency because they have many side effects. Moving on students, now let us talk about the birth control implants. Students, these are again contraceptives which are used by females. As you can see in the image, a tiny thin rod about the size of a matchstick is implanted under the skin of the upper arm. Students, this particular rod or this particular tiny tube contains progesterone and estrogen, and the mode of action is similar to that of pills. This rod keeps on secreting small amounts of hormones which make sure that ovulation does not occur. Moving on, students, these particular implants may prevent pregnancies for 3 to 4 years, but generally it is advisable to also make the use of barrier methods with the use of these implants. Moving on, students, now students, up till now whatever we studied were all the temporary methods of contraception. Let us now talk about the permanent methods. Students, the permanent methods to control students, the permanent methods to prevent pregnancies in now students, the permanent students, the permanent birth control method in men is called as vasectomy and in women it is called as tubectomy. Students, these are basically surgical methods and they are also referred to as sterilization. Moving on, students, let us first talk about vasectomy. Vasectomy is a very small surgical method. In this particular technique, a small part of the vas deferens is removed or tied up through a small incision made on the scrotum. Believe me, students, that this entire surgery takes little more than 15 to 20 minutes. Students, this is one of the easiest methods of permanent contraception. Moving on, students, tubectomy on the other hand is not a very tubectomy on the other hand is a slightly more invasive surgery. In this particular method, a small part of the fallopian tube is removed or tied up through a small incision in the abdomen, or generally it can be also done through the vagina. Students, these methods block the gamete transport and prevent pregnancy. Let me tell you, students, that these methods do not have any kind of side effects. They do not decrease the sexual pleasure or the sexual drive. Now, students, moving on, that is all we have for this particular topic. Let us now quickly go through what we studied today. We started by learning about the various contraceptive methods, under which we studied the different types, which included the temporary methods and the permanent methods. Students, if you have watched the video carefully, then answering these questions should be very easy for you. The first question is, can you name any two non-medicated IUDs? The second question is, what is tubectomy?